I think UDI allows us for the first time to both capture data and then use that long term to track clinical benefits. So forever we've had a problem about how do we know exactly what product we're talking about, and then how do we capture that data in a meaningful way so that we can track it for the future. And I think that's what UDI offers us. It truly says this is the number for this product regardless of who uses it. This is the number for that product. And that becomes really important as we start tracking outcomes data and as we start bringing these big diverse systems together. We need to be able to have that universal item number that tells us this is that item. So that what to look for title for my poster is based on looking for those symbols or barcodes or signs and even lettering on the packaging and then responding to that data. So we literally start by looking at a box of gloves and say, there are warning signs and symbols that are important on that. On the back, there's a manufacturer's date that become really important for patient safety as we make sure that our clinicians know how long their products are good for. We then take that and we kind of take that concept of looking for symbols and warnings and we take that to the barcode and to the UDI and then talk about how that UDI is important to us as a health system and to them as a caregiver going forward. Symbols and warnings can be really important because we're looking at patient safety or we're looking at the cost of the item. If someone misreads a date on the item or they see a date on the item and they assume that that's the expiration date because that's what's been plugged into us since we started in this business, they might think, that's expired and they might chunk it. Well, if they do, that item could be very expensive. And so we don't want to throw away an item that's still good. But on the same time, if we have a product that only has a manufacturer's date and does not have an expiration date per se, if we think that item is good forever, items don't last forever. Even something as simple as an ambu bag or a resuscitation bag has a useful life. So understanding how UDI can help you, and I'll give you a good example. I have an OR background. There's always been a disconnect in the OR between the person who pulls the supplies off the shelf, the person who opens the supplies in the patient room or in the surgical suite, and the person who documents the case, because it's usually not the same person. And we have lost charges. We're using things in the case that never get into the patient record that they've been used because it's 3 separate people using it. I think in the old days you would see nurses come out of the OR and they had stickers all over their body, right? And it's because they were using those charge stickers to document the case. Well, I can't tell you how many times you've seen them walking out of the OR with stickers or how many times you found the charge card laying in the room with all kinds of stickers on it, but no patient sticker or no patient label. So there was no way to capture that charges through. And I think one of the exciting things that UDI offers us in the use of barcode scanning is the ability to take that information and scan it into the EMR at every point along that process so that we know exactly what set of products were used on that patient. Now that has implication for costing, charging, long-term clinical effects of how well is that gender-specific knee compared to a regular knee? And until we get down to the serial number and know exactly what's in that case, I don't think we can do those studies long-term. And UDI offers us that ability to really connect the dots both in our systems and across our industry.